Okay, so we are going to cover the short-term and long-term effects. Now, the short-term effects are one slide long. Okay, just one single slide. You don't need to know more than that. This is how typically an unpolluted view will be, and this is when you have pollution. But this is outdoor pollution. Indoor pollution is a different ball game. There are completely different set of parameters you need to worry about. And then that's the reason I said we should not worry too much about what's discussed in the papers, because we, in news and everything, people worry about things outside. This view they worry about. What we need to worry about is what is on the other side of the window, our side of the window in this picture. And so now let's have this short-term effects. This is a short-term effects of air pollution can be combined in a single slide. You don't need to know anything more. It can trigger asthma and sneezing, cough, cold, wheezing, and even fatigue. See the middle one top, headache and fatigue. Some of you don't feel adequately rested when you wake up in the morning. You wake up at 7 and you feel as if you slept only for 6 hours when you actually slept for 7 hours. And when you go for a holiday, you almost feel as if you slept like a baby. And you think, oh, because I don't have any tension, that's why I've slept better. But most likely the reason is there is pollution in our cities. And when we go for a holiday, usually these are nice locations with lesser pollution, and sometimes the fatigue goes away and you are able to feel much more rested. And you can imagine, if there is pollution in the air, your lungs have to breathe maybe 5% more to get the same amount of good quality air. And so they tire out slowly. It's like doing a slow exercise. It's like you're walking very slowly for 24 hours. You will get tired, right? So that's the end of all the short-term effects. Problem is, everybody discusses short-term effects. Everybody worries about them. Everybody tries to solve them. And it's completely irrelevant based on the slides I'll show you. Look at this. Forget what is written on the slide. The large particles is you see on the left side this guy. So they go through your respiratory tract, and that's where they cause problem. The finer particles, everybody worries about them. The second picture, they go into your early part of your lung, and you get asthma and sneezing and those kind of things. Not sneezing. Sneezing will be at the first picture. Asthma will be in the second level. The third one, particles become really small. That's when you get all these respiratory and short-term problems. So top three, the left 1, 2, 3 are the problems which cause short-term effects. And what I'm going to show you on the right side is actually the main problem. These particles not only stay in your lung, they also go all over your body, and then they cause havoc all over your body. The problem is, everybody in the world talks about the first three, and nobody, well, we know about the fourth one, but the problem is by a completely different set of particles, as you will see as we go ahead. Now I'll give you some, now sorry, it's not going to be very humorous talk, it's going to be a little sad. This is one of the paper cuttings. What they did is they took Mexico City, they took about 200 people, youngsters who died, and then they checked their brains, they did some autopsy, and they found out that these youngsters, normally now Alzheimer's is dementia, memory loss. You start getting those particles after the age of 40, 50, vagera. Those problems start developing in your brain. But when you're 20 years old, there cannot be any Alzheimer's related things in your brain. But they found these abnormal proteins in the brains of kids as young as 11 months to people up to 40 years. Normally, you can't see this because for that you have to actually see the live brain. I mean, take the brain and open. So there is no test for it. And so this cannot be done for normal people. So these people had some kind of an accidental death or some other way these youngsters had died, and so they could do the autopsy. Now, this is Mexico City. Now, the next slide is even more dangerous. You see at the bottom, the researchers found hallmarks of this disease amongst 99.5% of the subjects. That means every single person they checked, 200, they found in everyone except one. 11-month-old baby, 40-year-old person, everyone they found that they were developing Alzheimer's. Youngsters are not supposed to get this. Medically, it happens after 40. So this is happening before. Now, what I did is I took this slide. This is about a few days ago, I think, just before Diwali. So on the left is the pollution level in Mexico City. I took it at the same time, okay? And this is Mumbai, it's 139. So 99.5% of the youngsters, not adults, so youngsters who are not supposed to have dementia problem developing in their brain, had this problem in Mexico City with much lower pollution than Mumbai. And we have this, Mumbai is like almost twice as bad as Mexico City if you see the numbers. And so I almost start saying that maybe 100% of us are developing some problem in our brain. And there are, of course, multiple reasons. They also found that, elderly people, lots of papers. So they found 7.5 years faster brain aging in the kind of pollution level we have. And in women also similar, 8 years old aging due to regular pollution, traffic pollution, regular pollution. Now, also I'll give you some interesting numbers. Now I have taken a region of Mumbai, one suburb, northern suburb of Mumbai. In 2019, 2020, the data was all chaos because of COVID. So 2019, let's say that place had 5 lakh population, 500,000 people. And the mortality rate for that, for India is 0.7%. That's normally the death rate. So that means in 2019, 3,500 people died in that suburb. This is North Bombay, suburbs of North Bombay. So I'm just giving you the context of how big this problem is. And now this is the article in Mint. They said, at least 31% of the deaths are due to, in India, whatever is happening. So 1 crore, some deaths every year happen. 25 lakh deaths happen every year because of air pollution. Okay, because of air pollution, 25 lakhs. So about 30% of the deaths that are happening in India. So if you put this in this chart, it means in that northern suburb of Mumbai, we had 1,000 deaths due to air pollution. Okay. Now, just to say, now 1,000 might look like, oh, it's high, but it's not high. Is it? Now, just to put that in perspective again, this is Indian Express article, which says every year, 30 lakh people die of stroke and heart disease in India. So 25 lakh die because of air pollution. Similarly, 30 lakh die because of stroke and heart attack. And you and I, we are really worried about stroke, heart attack, heart disease. We spend so much money. We talk about diet, talk about health. And we have 25 lakh dying because of air pollution and 30 lakh dying because of stroke and heart attack. So air pollution is on par with stroke and heart attack. We should be as worried about air pollution as stroke and heart attack, because stroke and heart attack are some of the biggest killers in India, right? And so air pollution is on par, but we never discussed this. We had this health, our community goes on, healthy aging and all. And I don't think we discuss air pollution as a problem at all. We worried about this and diet, acha rakho, stress reduce karo, exercise karo, this, that. You can do that, you can prevent heart attack, but can you prevent the air pollution deaths? So this is the context. 1,000 deaths due to air pollution, 1,200 due to heart attack and stroke combined. Now the next question, what do you think? Now, I have never seen a death certificate which says cause of death, air pollution. I don't think you have seen either, right? So what could be the case? Now, let me see if I put my video on. I want to see my face now. It's like, because I'm a little animated. Tell me if I am visible, not visible. It's okay, okay? Are you able to see me or?
Yes, we're able to see you.
Yes.
Good.
No, now you're visible.
Now if my face freezes, then, I'll remove myself. But yeah, so I think that's Zoom, because this is the third time it is happening and I don't know what to do. Everything else is working. So on our death certificate, we have never seen air pollution as the cause. So what is the cause? Lung cancer or emphysema? This is like breathing related problem, or bronchitis. What do you think is written? Any guesses? Just say. Anybody has a guess?
Might be something related to lungs.
Yeah, most likely that's what we think. Well, it's none of the above. Let me show you what actually will go on the death certificate if there is a death due to air pollution. It's very, very shocking. First time I heard, I was completely shocked. 72% of those air pollution deaths will go on the death certificate as heart attack and stroke. 72. That's a WHO number, and it's obviously very detailed and all that. Let's not go into it. What it means is, in that Mumbai region that I was discussing, there are 1,000 people dying because of air pollution. 1,200 are dying because of heart attack and stroke. And 72% of these are due to both air pollution as well as heart attack and stroke. So if you calculate that superset, it means 720 heart attack and stroke deaths out of 1,200 are due to air pollution. That means 60% of the heart attack and stroke deaths that you and I see in our life are because of air pollution. and only 40% of because of non-air pollution causes, which means your doctor can't do anything. I sometimes, when I give a talk in medical conferences, I tell them, jokingly, of course, you can prevent only 60% of the 40% of the deaths. You cannot do anything for 60%. I'm somebody who can do something because I'm an engineer. So I jokingly say, I can do something to the deaths due to air pollution. But this is what it is. We are so worried about preventing heart attack and stroke and this. We can't do anything if it's due to air pollution. You can do only for, so all the precautions that we are taking are relevant only for 40% of the cases. Imagine, I mean, there is never any discussion. Whereas the solution to the air pollution could be very, very simple. Now, why does air pollution cause this damage? Well, simple answer. You people know in this group, inflammation. You remember this picture that I showed you? The minute these particles, pollution particles, go in your blood through blood, the right side, the fourth part on the right side, now it's an external particle. It causes, it's like a virus coming in, a bacteria coming in, some pollutants coming in. Your body's immune system goes into action and inflammation increases. And that inflammation, because air pollution keeps it all the time, the inflammation becomes chronic inflammation, and chronic inflammation is a cause of heart attacks, stroke, cancer. I mean, all the degenerative disorders are usually having a root in chronic inflammation. And so that's it. It's like, so air pollution is actually leading to all sorts of degenerative disorders. Sometimes it's not just our lifestyle, it's our life. It's not lifestyle. Because even if you are healthy, you're still breathing that air. In fact, see this is what is happening. Lung cancer, we put 1988, 90% of the people were smokers who got lung cancer, and 10% were non-smokers. Now we are finding 50% are smokers, 50% are non-smokers. So if I'm a doctor and I get a lung cancer patient, usually it'll be 50, 60-year-old person who has been smoking all his life, and usually a male, because typically men smoke. Now a 25-year-old, spiritually very, somebody who eats vegetarian, healthy food, young housewife could have lung cancer. 50% chance. She doesn't have to be a smoker. She doesn't have to have any bad lifestyle. Her only fault is she lives in India. I mean, this is what has happened with this. And so there are lots of other issues that happen. I don't want to go into too much depth, very depressed. Some of my articles, I just read that, so they're worsening emphysema. You see neuropsychiatric disorders on the left side. Bottom, you see thyroid problems. These things are going into newborn. When you get thyroid problems, their development goes down. So children don't develop properly. They have those developmental milestones go down because they get hypothyroidism and all that. There are women's placenta, you see this. On the right side bottom, there is an article, why your children might be doing badly in exams. So next time you want to scold your child, first check, well, maybe you have to give good air to the child. If your child knows, will say, dad or mom, I'm getting all this polluted air, that's why I'm doing badly in the exams. Children actually did better. They found out the average marks of the students were different based on the pollution. It was like different cities, different towns had different, same exam they conducted all over UK, and they found the results were different. And so that's what is happening. And on the right side top, there is also an article. You see all these pollutants. We try to, sometimes people ask me, can I put this, some mask in my nose, and can I do this, and can I do that, and all that. These pollutant particles, which are very, very small, which actually cause this inflammation, one of the things they found is a completely different route. They don't even go through your lungs, because if they're going through your lungs, you can do something and you can try this and try that. What they do in your nose, there is a nerve called olfactory nerve, which tells you smells. When you inhale, you kind of smell it. So that nerve directly goes from your nose to your brain, from inside your skull. These particles climb onto that nerve. They're so fine. Your body is completely defenseless, and they climb onto that nerve and go in your brain. And these are magnetite particles, and they accumulate there. So they stay in your brain permanently. There's no way to remove them. And then they inflame your brain. And that's why we're getting this Alzheimer's. Now, I told you before we started the talk that I'm seeing these connections. I have not read this in any paper where people are directly looking at it. But when you know these 10 things happening, particles are going through, they're taking a different route, there's inflammation, they go in your brain, they cannot come out. What is the logical conclusion? They will inflame your brain, and inflammatory problems of your brain will come up. Alzheimer's is one of them. dementia, other dementias will be one of them. Depression will happen. That's not because you are bad, it's because your air is bad. And so all these things are slowly getting researched because the data is so low. It's like, the problem they have in UK is very, very little. The big problem is in China. The big problem is in India. And so we are sitting on a pile. It's like, I almost want to make a statement here that all of you who are living in India, you have Alzheimer's developing in your brain. If the first article that I showed you is developing, it's just, we don't know whether it will come after 10 years or 15 years or 20 years. It's just, that's it. Now, many of you, last few points I want to just say, okay, people think this is pollution. Oh, this is really polluted. And people think this is the closest you've come to pollution. But if I show you this, your room, you will think this is not pollution. In fact, if you zoom in, okay, this image is slightly blurred, but you don't see any pollution. So where is this pollution? So broadly, the pollution particles are so small, your eyes cannot see it. We see all those nice pictures, but those are not really the particles that are dangerous. Those particles can cause sneezing, they cause short-term effects and allergies and maybe even asthma. But allergies don't really kill you as much as heart attack and stroke. The real dangerous particles are very small. And so I want to give you a few points on that. Now, this is an image which tells you what are those particles. So you saw those, that large particles, they're called PM10. In next talk, I'm going to explain these and how you protect yourself and what kind of air filtration you should look at and which particles cause what problems and what are the implications, where should you be careful and where you need not worry. I'll tell you later, but broadly speaking, this is a strand of your hair. And these particles, this is like a 50 micron size, 50, 60, 70. Your eyes cannot see below 20 microns. Usually your eyes cannot see below 30 microns. So 50 micron is sort of borderline of what you can see. And the particles which start causing allergy and all that are called PM10. And that's how small they are. Your eyes cannot see it. So if you see it in the picture, that also is sort of borderline. It's not really those particles, unless they're you see a very far distance. And even dangerous particles are PM 2.5. They're 1/4 the size of this. And then there are particles which are even 10 times smaller than them, which essentially your body has defense at nasal level. You have hair and mucus in which they get trapped. But it's the minute these particles become 10 times, 20 times, 50 times, 100 times smaller, there is no way your body can stop them. It's almost like putting a fence. If you get a thief or a cow or a bull or a dog, you can stop it with that fence. But the minute it becomes a small rat, your building fence cannot stop it. It can just come through that small space. And the minute it goes into a small mouse, a cockroach, or maybe if you go to a mosquito size, those are completely hopeless. Now try to make it 10, 15, 20 times smaller bugs. You have no defense in your society to prevent those bugs from coming in. They just come through, however good your gate is, unless it's a completely sealed wall. And that's exactly what happens. These particles come in our body. Now, last point, and then we'll probably end, chemicals. Indoor, you don't just have to worry about physical particles. You have to worry about chemical particles. And most of us worry about, car exhaust and ozone layer and nitric oxide. How many hours a day you are outdoors? I'm not talking about COVID, even outside of COVID. You might be in your office, you might be in your car, you might be in your home, but you are rarely on the road. Nobody is on the road for 10 hours, at least our, well-to-do educated class. We are not physical laborers. So we don't have to worry about these. On the right is what you need to worry about. There are something called volatile organic compounds, and they're very dangerous. And usually they're not dangerous outside, because once they go out, they break down in sunlight or break down in open space. It's just they evaporate, essentially get converted into water and carbon dioxide. But when they are in your house, they stay as this problem. Now, formaldehyde, I'm making a video on this. Formaldehyde is a gas. It's a cancer-causing gas, and it's emitted by everything in your house when you get it. Furniture, upholsteries, the wood panels, the wallpapers, wall paints, bed sheets, everything keeps emitting this for first 1-2 years for sure. And wood made up of plywood and all keeps emitting it up to 10 years. And so these normally in open spaces, in the way the houses were 30-40 years back when there was no AC, they would just go out, disperse, and that's it. You didn't have to worry about them. Now with an AC house, usually this formaldehyde stays inside, and you must have sprayed some of this when you get new furniture. That initial few days you get that very toxic smell, but it goes away after 5 days. Well, it doesn't go away, it just goes below your nose detection capacity, and they are very, very dangerous. Then we have deodorants, we have disinfectants, we use mosquito repellent. Now what do? We just don't die because of those mosquito repellent. Mosquitoes do. So incense sticks we use, and these are the bigger dangers. They are in your house, the bigger chemicals, the bigger, in the sense, more risky chemicals. And their third thing, physical, chemical, and the third one is biological. The biological part of pollution is all these bacteria, virus. If you have birds, bird feathers, if your dog, pet dander, we have fungus on the wall many times in monsoon. Pollen is a big problem in places like Bangalore. And so house mites, this is a picture of a house mite. It's quite likely it's there on your face. If you zoom your face 1,000 times, you'll see a bug like that. They're very gross, but they are there in your pillow covers. Now these, if they're airborne, they can cause problem too. So that also is indoor air pollution. And so I'll stop here. Just to tell you, this was the slide, which is the world's most expensive error, in my opinion. It's going to cost $1 trillion to the world and billion lives, because there is a small error in this picture. And I have not read anywhere where they have found this error. And everyone uses this as a reference. In Delhi, government uses this, Indian government uses this, international governments use this, but there is one error. And it's so devastating, as I said. Let's see how many of you can get it. Maybe I'll give you 1 week. Next week we meet, we take it from here and tell you how exactly we go further. But it's the world's costliest error.